It's to northeastern Nigeria now, where a surge in chronic kidney disease is alarming health officials. The number of patients needing dialysis and transplants is unusually high, and the cause remains unknown. The most affected areas are Borno and Yobe states, where authorities have launched a study to investigate. I'll talk to a senior medical practitioner in a moment, but first, here's my report from Maiduguri. It's busy in the nephrology ward of the University of Maiduguri Teaching Hospital. This is where patients with kidney-related illnesses are treated. Abdullahi is on dialysis. He's shivering under the blanket because the treatment makes him feel cold. To respect his privacy, we're not showing his face.
Today is my 14th session of hemodialysis, and I usually come here twice a week for the dialysis.
A session of dialysis here takes about 4 hours. The procedure involves removing blood from the body, filtering out toxins and excess fluid from it, then pumping the cleaned blood back into the veins. There's high demand for dialysis in northeast Nigeria, where the number of people suffering with chronic kidney disease is so high, it has the authorities concerned. Global prevalence of kidney disease is between 12 to 14%. In Borno State, it's almost twice that, and a hotspot has been identified. The community of Gwange has been found to have the highest prevalence of chronic kidney disease in the Maiduguri metropolis. According to research, 3 in 10 people here are likely to have the condition. Authorities don't know why there are so many cases of kidney disease in the region. They've commissioned a study to find out what's driving the disease. Some of the factors they're considering are the use of unregulated over-the-counter pharmaceuticals like painkillers. They're testing the drinking water for the presence of certain compounds and minerals. There's also the possibility that the increased use of insecticides on the grains and fresh produce people are eating could have something to do with it. There might also be a link to genetics. The results of the study are expected in the coming months, but in the meantime, preliminary data has revealed a common factor.
We have found out that there is something in our environment that makes the prevalence to be higher. One of these things is dehydration, perspiration. The heat in this environment is very high, and the temperature goes as high as 42 to 44 degrees Celsius during summer, and people sweat a lot during this period. They don't take enough water, enough fluids to compensate for what they have been losing for perspiration. So this kind of things injures kidneys over time.
Hot weather has long been known to exacerbate kidney disease. Rising temperatures caused by climate change means it's getting even hotter in this region. For Abdullahi and many others here, kidney disease is not just a health burden.
I need a kidney transplant because this dialysis is something of temporary, and the money we usually spend for this dialysis is too high. For every session, I spend almost more than I get into almost 40,000, and I'm the one paying bills for myself, so it's not easy. I have sold some of my belongings for the transplant.
The local government in Borno State says it's increasing its capacity to provide affordable healthcare for people with kidney disease. That includes subsidizing the cost of kidney transplants. Dr. Ibrahim Ummate was in the report you just saw. He's the director of the Kidney Center at the University of Maiduguri Teaching Hospital. Now, the hospital recently resumed kidney transplant operations in response to the high prevalence of kidney disease in Borno and Yobe State. It's good to talk to you again, Dr. Ummate. When I interviewed you in Maiduguri last August, you told me about the study that was being done to try to establish the reason for the high prevalence of kidney disease in Maiduguri or in Borno, and neighboring Yobe State. Do you have some results you can share with us?
Yes, I have some results I can share. We have started the study, but now we are just at the prevalence level. We know the prevalence of the kidney disease in the various communities of Maiduguri. The highest prevalence is in Gwange area, which is about 31% prevalence. That is
crude kidney disease, which means from stages 1 to end stage. But some areas have less prevalence. But in total, in general, the average prevalence in Maiduguri metropolis combined is about 26%. And it's still higher than the prevalence found worldwide, which is about 12 to 13%. And the prevalence in Nigeria, they date back to about last year. Some group of individuals did it and collected the prevalence of various states. And now they came out with prevalence of about 18% in the country, 18 to 20%. But our own is about 26% overall prevalence in Borno State.
Right. Professor, why is the prevalence of kidney disease so high in Borno State and in neighboring Yobe State?
Well, the prevalence in Yobe and Borno may be for different reasons. For Yobe, I could say we are still searching too, just like that for Borno. But let me start with Yobe. For Yobe, we are thinking is from the source of water in the state, more especially those around riverine areas. There is what you call River Yobe. And those people around these areas are the ones that have higher prevalence. So we think is the source of water there that has some heavy elements or trace elements in the waters that causes kidney disease. That of Borno, we have searched our waters. We have already conducted the studies on the waters. The waters is not implicated. The source of that is not the problem, but it has to do with the lifestyle of the individuals, because many of them take over-the-counter medications, taking a lot of pain relief over the counter without consulting health personnel or without consulting doctors. And then some of them take traditional herbs. And this thing adds to the burden of the kidney disease in our environment. And you should you should not notice that our environment there, more especially Maiduguri, has a very high temperature, more especially during summer. And these high temperatures tend to increase the prevalence of kidney disease too, because as people perspire now a lot, they don't pass a lot of fluids. And so the nephrons tend to die gradually and then subsequently causes chronic kidney disease. What we are doing now is we have already concluded that the water is not the problem. And what we are doing now is we are proceeding to look at the genetics of our individuals. So we are now at the stage of genetics to see the genetic makeup of our people in Borno. And after the genetic makeup, then we assess and see whether truly the heat that we are talking about has impact on prevalence of kidney disease. The issue of drugs and some herbs that people are taking, that one is actually a non-issue. The people do take it and they take it overdose usually, more especially herbs. They don't even know what the dose is supposed to be. And so they take just anyhow. So these are the things that we are thinking. So after we have found out our findings is out, then we'll now go on intensive campaign and enlightenment to reduce the prevalence of the disease in our environment.
Okay, Professor, Dr. Ibrahim Ummate, because you're both, thank you so much for being on DW News Africa, and we look forward to having you back where you can really share the full results of the study that you're conducting on the prevalence of kidney disease in Borno and Yobe states. Thank you, Professor.